Hello students. So as we have started with chapter 4 and I have covered the concepts of abnormality and psychological distress. I hope by now you know what are the concepts of abnormality and psychological disorders, and also I have covered the two approaches of abnormal behavior. Okay, here in this presentation we will move on to the next part where I will cover the history of psychological disorder from the point of supernatural approach, biological approach, psychological approach, history of Western civilization, organismic approach, Middle Ages, demonology, Renaissance period, age of reason and enlightenment, and at last interactional approach. History of psychological disorders. So here we will do the historical background of the psychological disorders, starting from ancient times. So to understand the psychological disorders, we will require a brief historical account of how those disorders have been viewed over the ages. Alright, so when we study the history of abnormal psychology, we find that certain theories have occurred over and over again. And from ancient times, one ancient theory that is still encountered today holds that abnormal behavior can be explained by operation of supernatural and magical forces. This is what one part of population believed during that time, that it is some kind of supernatural work. So they believed that these abnormal behaviors or these disorders were attributed to operation of supernatural or magical forces, that is evil spirits and devil was associated for certain kind of abnormal behaviors. So what they did is that there was exorcism, counter magic and prayers which were practiced back then in order to cure the patient. Alright, so I hope you all also know, you have also heard about this possession part, exorcism part, isn't it? So earlier back then, when a person was having any kind of psychological disorder, the other people believed that it is the act of some kind of supernatural activity. And instead of going to a doctor, and back then there was no doctors also available because they did not study about this science. So what they did is that in order to cure the person, in many societies, the shaman or medicine man, we all call it ojha, isn't it? So that those kind of person were called, and he basically he is a person who is believed to have contact with supernatural forces and is the medium through which spirits communicate with human beings. So this is what people back then used to believe. Now through this shaman, this man, an afflicted person can learn which spirits are responsible for his or her problems and what needs to be done to appease them, to cure them. Alright, so from that approach, basically the concept of abnormality started, and from there is this biological approach, which basically is a recurring theme in the history of abnormal psychology, where this approach believes that people behave abnormal because their bodies and brains are not functioning normally. And this is basically the biological or organic approach. And in the modern era, there is evidence that body and brain processes have been linked to many types of maladaptive behavior. And for certain types of disorders, correcting these defective biological processes results in improved functioning. Alright, after this, there is another approach, which is the psychological approach, and according to this point, psychological problems are caused by inadequacies in the way an individual thinks, feels, or perceives the world. So basically, the way you think, the way you feel, or the way you perceive the world, it affects the person, and it adversely depicts that yes, the person needs help and the person needs some kind of cure All right. So moving on to abnormal behavior studied in Western civilization, as we have already gone through the three perspectives, that is supernatural, biological or organic, and psychological. Now, these three perspectives have been recorded throughout the history of Western civilization, back and forth. And here, once again, comes into scene organismic approach. So in the ancient Western world, it was philosophers, physicians of ancient Greece such as Hippocrates, Socrates, and in particular Plato, who developed the organismic approach and viewed disturbed behavior as arising out of conflicts between emotion and reason. And with the aspects of Hippocrates, he was the one who talked about the conflict between emotion and reason. So it is the way I use logic and the way I feel, there is a conflict between the two. So Hippocrates here talked about the four humors in the body taken from Galen, who talked about the four humors as well. So Galen elaborated on the role of the four humors in personal character and temperament. According to him, the material world was made up of four elements, that is earth, air, fire, and water, which is combined to form again four essential body fluids, that is blood, black bile, yellow bile, and flame. In Indian concept also we have the concept of Panchbhut, from which we say our body is made of. Okay, five elements. But here Galen and Hippocrates has considered the four elements or aspects, and these are this air, fire, water, earth. Now each of the fluids was seen to be responsible for a different temperament, and imbalances among the humors were believed to cause various disorders. Similarly, Indian notion of the three doshas of Vata, Pitta, and Kapha, which were mentioned in the Atharva Veda and Ayurvedic text. So here also all these imbalances, body fluids imbalances, affects one's personality. And if you go back to the chapter 2, you have gone through all this over there. So here also we are talking about those doshas. Okay. So you go back to that and read once again. From there, we'll move on to the Middle Ages, where demonology and superstition gained renewed importance in explaining abnormal behavior. And here, demonology was related to a belief that people with mental problems were evil, alright, and there are numerous instances of witch hunts during this period. So, the person who was suffering from certain kind of mental disorders or abnormal behavior, they do so people used to call them witches, or like demons, evils. So during the early Middle Ages, it, it was the Christian spirit of charity which prevailed, and there was a person, Saint Augustine, who wrote extensively about feelings, mental anguish, and conflict. And basically because of Saint Augustine, there was the groundwork for modern psychodynamic theories of abnormal behavior. So that was the groundwork. He laid the groundwork for the study of modern psychology. Next, moving on to the Renaissance period, which was seen in 15th and 16th century, and this was marked by increased humanism and curiosity about behavior. Back then, in the Middle Ages, where the abnormal behaviors were related to some kind of demonology and superstitions, but with the groundwork of Saint Augustine in the Renaissance period, that is 15th and 16th century, the disturbed people were treated more humanly. All right, and it was Johann Weir who emphasized psychological conflict and disturbed interpersonal relationships as causes of psychological disorders. And he also insisted that witches were mentally disturbed and required medical, not theological treatment. So the people who were having some kind of psychological disorder, they needed treatment, proper treatment, but not any kind of, ojaha, or some kind of person who will be helping in this possessions and all. Mm, exorcism and all. So the people did not want that back in Renaissance period. Next, moving on to the 17th and 18th centuries, which were known as the age of reason and enlightenment. As the name itself suggests, reason and enlightenment. So the scientific method replaced faith and dogma as the ways of understanding abnormal behavior. And the growth of a scientific attitude towards psychological disorders in the 18th century basically conformed and contributed to the reform movement and to increase compassion for people who suffer from these disorders. There were reforms of asylums in this century. Alright, so people during this century moved psychologically problematic people to certain kind of institutions, and they were treated with proper care, proper medical treatment were given over there. And one aspect of the reform movement was the new inclination for deinstitutionalization, which placed emphasis on providing community care for recovered mentally ill individuals. So, in the reform movement, the people who were kept in institutions for medical attention, for care and treatment, so it was provisioned over in the reform movement that they should be brought out of the institutions once they are cured, and they should go back to the community so that they can live a better life afterwards, and their community care was given to the people. So that is why emphasis was made on providing community care for recovered mentally ill individuals. All right, and with all this there is another approach which is known as interactional approach or biopsychosocial approach. And it has been just recently converged, which has resulted in an interactional or biopsychosocial approach. And from this perspective, all three factors, that is biological, psychological, and social, play an important role in influencing the expression and outcome of psychological disorders. Here, biopsychosocial, we have three aspects where bio basically refers to bodily processes, that is the neurotransmitters. The psychological approach refers to all the components of conflicts in a person's mind, and it also refers to the interpersonal aspect, that we understood the emotions and the reason. Alright, and then there is this social approach, which of course the way family treats a person, the kind of condition a person gets outside. Alright, so with this we get to know about the history of the psychological disorders, how it evolved, and in recent times how it got its place and its value.